Welcome to Scoop and Scale, where we dish up the science and weigh the facts about mostly equine nutrition. I'm Jill Jackson, lifelong equestrian, podcast producer, and pony owner. I'm a dressage rider and at-home horse keeper, living the challenge of managing easy keepers on multiple acres of pasture.
And I'm equine nutrition consultant, Dr. Claire Tunis of Clarity Equine Nutrition. I develop diet plans for horses ranging from metabolic seniors to Olympic athletes. I also consult for equine nutrition companies. I'm a scientist, dressage rider, and pony club mom.
Claire and I have been horse friends for almost 20 years, and like all good horse friends, we're always talking horses. We talk about the challenges of managing our horses, our riding struggles, feeding horses, and what's going on in the wider equine community. This podcast is a place for us to have conversations mostly about equine nutrition. It's for anyone who wants to make better choices when it comes to feeding their horses.
And before we get started, a quick disclaimer. The information in this podcast is general and not meant to replace the individualized advice of your own qualified equine nutritionist or veterinarian. And while I have a PhD in nutrition, I'm not a veterinarian and can't give medical advice.
With that, thank you for joining us, and we hope you enjoy the following episode.
As an equine nutrition consultant, I tend to work with horses that have health conditions that have a nutrition management component. Often it's a muscle myopathy or a metabolic condition, gastric ulcers or recurrent colics. But another common issue I see a lot are horses struggling with allergies. As we head into the spring and summer, many horses that deal with allergies start to struggle and can become increasingly challenging to manage. Recently, while I was at the Kentucky Equine Research Conference, I was lucky enough to get to hear veterinary dermatologist Dr. Rosanna Marsella speak on the topic of allergies in horses and food allergy testing, and I thought she would be an excellent guest for the podcast. So I'm thrilled that Dr. Marsella agreed to join us today. Dr. Marsella, welcome to Scoop and Scale.
Thank you for giving me the opportunity. Appreciate it.
As always, when we have a guest on the podcast, we start with a little bit about your background and the work you do. You're based out of the University of Florida. Could you share a little bit about yourself, your work, and how you developed your interest in allergies?
Yes, I am a dermatologist for animals. I have been doing this since 94, so a while. And I have been a faculty member at UF since 97. So a while. My main area of research is allergies. I started with dogs, and dogs and horses too. They develop allergies are very similar to human allergies, and people call eczema. Kids have eczema, and as adults they can have asthma. Dogs typically stay in the eczema phase, and horses, they can have both eczema and respiratory issues like COPD. So I started with dogs, and I did this for like 20 years. And then my heart and passion is horses. And so I kind of slowly but surely kind of moved a little bit away from dogs and focused my research on equine allergies. In the last few years, the last 6 years, I have worked on identifying the main mediator of itch in horses. And we know that there's a molecule called interleukin-31, which is very important for itch and inflammation in horses, and developed an antibody to block it. So the last few years, that's what I have been working on with the hope to provide horses with an alternative to steroids. Those horses have very few drugs. Other species have more options, like dogs have Apoquel, Cytopoint, you name it. There's so many different drugs out there that over the years, and thank God for that. But horses have very few options. So that's what I've been working on.
Yeah, that'll be huge. I'm going to hear our listeners with itchy horses saying, please hurry. But good science always takes time. So let's start at the beginning for our listeners. Could you explain what an allergy actually is?
Yes. So an allergy is an exaggerated response to triggers that are otherwise well tolerated. So a normal individual, when presented with dust mites or pollen of different sorts, will not react to it. Is tolerant. An allergic individual that has a genetic predisposition toward the development of allergy will overreact. And so it will make a different kind of antibody, which is called IgE. The normal one will make IgG, and the allergic one will make IgE. And the response is counterproductive. So it's an excessive, counterproductive reaction to triggers that are otherwise well tolerated by normal individuals.
So, can you have an allergy to something you've never been in contact with before?
So the original dogma was no, that you cannot be allergic to something you've never seen before, right? And so we now know that there are components, whether it is a food or a pollen, they are conserved. And so you might not have seen that specific pollen, but if you are allergic to that component that is conserved, you may actually react at first exposure because you've seen something, not exactly that, but something that is related to that or that has that component. Therefore, your immune system will recognize it at first encounter.
Oh, that's interesting.
And
Yeah, because I remember people saying, "Oh, you can't be allergic to that. You've never had that, come into contact with that before." So that's an interesting new piece of knowledge.
yeah, and we struggle with this, and so going back for a second to small animal, that was the dogma about food allergies. That basically you could not have an allergy to a food you never ingested before, and that was the base for food trials.
Right.
We would basically select a new source of protein. But now we know that that was not 100% true because there are some parts of the meat, in this case for dogs was typically a meat source, they are conserved across species, and so that you could have a reaction to something you never had before. So with horses, we know very little, but in terms of pollen, we know that that is the case because there is cross-reactivity among pollens. Yeah.
When I think about allergic reactions in people, like they seem to fall into two different categories. Contact dermatitis, so you react to laundry detergent or something that you touched, or you have allergies and they're bad because of the pollen in the air, or there's mold in your house, something like that. I assume horses are the same.
Yeah, so to some degree, so you can have a contact allergy. That is true, which means the type of immune response is called type 4 hypersensitivity, that is through the skin. So that is true. That is true for people. It's true for horses. And then you can have the atopic dermatitis / eczema, where the exposure is primarily still through the skin. So it's still an exposure through the skin, but the type of immune response that is built is different. It's a type 1. And then the same allergen can also be inhaled so that you have the inhalation component. And that's why environmental allergies many times are both skin and respiratory. But even for pollen, the cutaneous absorption is huge. This is important to remember because then topical therapy is important even for allergies or non-contact allergy. Even for the pollen allergy, frequent washing is important.
So you're saying that they can actually react to pollen on their skin?
Yes. So we have plenty of evidence in people, in dogs, and now preliminary in horses that we call it epicutaneous, so the absorption of the pollen through the skin is one of the main routes of sensitization and elicitation of signs. So this is how you become allergic and how you will react upon exposure. And the reason for it is that the skin of atopic individuals is not normal. The skin, if you have, let's say if you're a kid and you are prone to eczema, your skin is always a bit dry and absorbs more. This is how you're more likely to become sensitized, because the skin barrier function is not good, is not normal. And that ties into why people do, let's say, essential fatty acids and all these other strategies to improve skin barrier function.
How do allergies tend to present themselves clinically in horses?
So the pollen allergy, most of the time is through cutaneous signs. So they have itching, and then because of the itching and the self-trauma and the fact that the skin is not normal, they develop secondary skin infections. And the primary areas that are targeted are the face, around the eyes, the flexure surfaces. So like we call it antebrachial, which is the juncture of the leg to the chest, and the inguinal area, which is the juncture of the hind legs to the body. So all the areas where the skin is thinner and where the pollen gets stuck in the folds. And so those are very delicate areas, and that's where they get itchy at the very beginning. Then it can become the whole body. But those are the primary areas for pollen allergy, which are different areas compared to the ones that are covered by insect allergy. Because horses also get a lot of insect allergies. We're not touched on that yet. And those are the primary insect is like culicoides, also called Nocean. And those are the areas that are covered in, they're targeted by those allergies are the preferential feeding sites of those insects, which is typically the ears, the mane, and the tail-based area. But many allergic horses have a combination of insect allergy and pollen allergy. So they kind of like they have, a combination of sides.
Yeah, poor things. They don't get away with just one. I think when they're sensitive to allergies, it does seem that they are just sensitive to all kinds of things.
Right, because it's who you are genetically, right?
Absolutely.
Yeah.
So you mentioned a word earlier, which was atopic dermatitis, and perhaps you could explain that. But also a couple other words that I hear vets use in relation to skin allergies, or just when horses have symptoms, pruritus and urticaria, and I think they're not words that we generally use as horse owners. We call them something else. So could you perhaps explain, because again, if your vet comes out, they're going to say, oh, does your horse have urticaria? And you're going to be like, does it have what? So, if you have that phone call or whatever. So what are some of these terms that the veterinarians might be using with their clients that the clients are like, I don't even know what that is?
Yes. Okay. So good point. So pruritus is itching. Okay. So itchy skin is pruritic skin. So that's that. Urticaria is the fancy term for hives. Okay, so and it's very common manifestation of allergy in horses. And how do you know that your horse has hives? So basically these are soft lesions. They are very transient. If you press on it, they disappear, and they appear quickly. Right. And so it can be the face, or it could be, depending on what the trigger is, it basically typically starts on the face or around the throat, the neck, and then it can become the whole body. And it can be insect bites. It can be, sometimes of hay, like peanut hay is very allergenic that way. And so those are short-lived histamine-based type lesions. So this is urticaria.
I quite like the scientific urticaria. Sounds much better than hives. At least it sounds fancy, right? It's like if my horse has hives, sounds really sort of like, oh.
You say there's nothing fancy about your horse having hives.
I know.
And then, sorry,
Okay.
go ahead.
I wanted to make a point. Hives, most of the time in horses, are not itchy. Okay, so it's not what people would imagine, right? You think you have an allergic reaction and you're swollen and all that. But histamine is not a main mediator of itch in horses. This is why when people use, let's say, Benadryl to help with itching, it doesn't work because it's not about histamine, right? So you will give Benadryl for the hives,
Right.
but if you have an itchy horse that, let's say, does not have hives, then your Benadryl is not going to save you.
Interesting.
Interesting.
Yeah.
Huh.
Yeah.
Both Jill and I have
Let's
had
all think
allergy
about
horses,
that for a
so
second.
this is we've lived this experience, so this is all very interesting to us.
Yeah, so because the people, let's say you have an insect allergic horse, right? And it's very, very itchy. And people give hydroxyzine, Trihist, cetirizine, Benadryl, and quote, nothing helps. But nothing helps because histamine is not an important mediator of itch in horses.
So a lot of people give Zyrtec, right? So that's cetirizine for itchy horses, and it won't work for itch.
It doesn't. So, matter of fact, there was a few years ago, there was a published study, and it was a placebo-controlled study where they, half of the horses got placebo, half of them got cetirizine, which is Zyrtec. And at the end of the study, which was like 3 weeks, the efficacy in the Zyrtec group was, quote, as good as the placebo, which was not zero, was 30%, because that's your placebo effect. And so that's why, people do it all the time. It's human nature. But truly, you could be in that 30% get benefit, but it's not really a very effective treatment for itching in horses.
Well, and Claire, your hives, like your horses all have itchy hives. My horse has respiratory issues, which the hives, I think, are maybe they're secondary. I don't know, but he's never itchy.
Right.
So,
and I'm sitting here realizing giving Zyrtec for my flyby itches is pointless.
It's a waste of time.
Yeah, save myself some money. I love this episode.
And the other question was atopic dermatitis. Did you mention that one?
Yeah. So atopic dermatitis. So atopy is a broader term. To basically encompass both the skin manifestation of, let's say, a pollen allergy and the respiratory manifestations, which is asthma and so on. And some atopic individual, have other skin. Some have skin plus lungs, or some have lungs only. But atopy is this abnormal reaction to pollen, which is an IgE-mediated reaction. It's when the individual will make IgE against environmental allergens. That's the word atopy. Does it make sense?
Yeah, no, it does.
So the reason I'm like pondering all this, and we're going to get into like the situation with my pony that, was pretty extreme. And so like, as you're saying all these things, I'm like, like this is just all so fascinating now. I mean, looking back on it, we did try everything, but again, we're going to talk about that. So yeah, I'm not having a confused face because I'm confused. I'm just like pondering all the steps that I went through for 4 years to try to get this figured out. And here we are.
Well, now you have my phone number.
Yeah.
So how do you know, like, if you're a horse owner, like, I mean, like you mentioned, sometimes horses don't even sort of like display obvious allergy signs. How do you know when you should get your vet involved, right? So if I go out one morning and my horse is covered in hives, do I call my vet? Or do I see if they go away? Or, if he's rubbing a lot and seems itchy, do I call my vet? Like, how do I know when I should get vet? Like, when do I just wait and there's a tincture of time versus I need to phone my vet?
I would say it depends on the severity and the speed of development, right? So if you have, let's say, a couple hives that are developing slowly over time, maybe no big deal. But if you have this acute onset of severe lesions, they are kind of like progressing rapidly, then I would say definitely you want to get on the phone. To avoid that the allergic reaction, talking about hives now, it will go from just a localized reaction to a systemic reaction. Um, so now, Benadryl, it would be the answer to the hives. If your vet is not close by, then it's always helpful to have a big jug of Benadryl. So the average horse would be like, about 500 milligram of Benadryl. So depending on the size pills that you have, which is 25 or 50, whatever, you calculate how many pills. And you can start working on crushing your pills while you wait for your vet, right? That would be like a simple recommendation to owners. Now, the itching, let's say you have it's an allergic horse. Those are typically like chronic. They're chronic, progressive, that have degenerated over time. And I would have to say, I hope that people seek help for their animals sooner rather than later. For one, is a miserable life. For two, once they develop bacterial infections, then it becomes more difficult to help and to fix the problem. So itch is additive. It's typically not just one single thing. Right? So you have insect allergy, that's one level. Then you get a bacterial infection, then you're at this point you're level 2, or then you get a yeast infection, then you're level 3. And so then you exceed that threshold that you can tolerate, and then you do massive, sub-trauma and so on. So the interesting thing to remember, horses carry on their skin the same staphylococcus that you and I have, which is Staph aureus. Okay? So horses that get staph infections, they get Staph aureus infection. So it's very important that when we address those infections, we do it properly and that we don't use or abuse antibiotics, because basically we're all connected, and the carriage side for Staphylococcus is the face, the nostrils, and so on, which is where people have the contact with their animal, right? Putting the bit, putting the halter, and so on. So basically, helping with the staph infection of the horse is not just you're doing the right thing to help your horse. You're also helping yourself.
Yeah.
Because we're all connected, right? So I think to answer the question, I would say the moment that people realize that allergies, if left untreated, have a chronic progressive course. They don't go away.
So the question that comes to mind then, so I think sometimes in the course of treatment, I think I'm correct here, you can correct me if I'm wrong, like a veterinarian may do, say, like a skin scraping or whatever to send it away for analysis. If that's actually correct, is that because they're wanting to see if there's bacteria and yeast and things involved so that they know how to treat it properly?
So the skin scraping is done for mites.
Oh, for mites. Okay.
For the bacteria and the yeast, you do a cytology, which could be an impression smear with a slide, or could be a tape or a swab. And then if, let's say, the animal has been on antibiotic, they may send that swab to the laboratory to see what kind of bacteria and what is the sensitivity of that bacteria. But the scraping is done for mites. Okay. Let's say you have horses itching on his legs, and one differential diagnosis is a mite called Coreoptes. And so they want to make sure that they're not missing that. They might be doing the skin scraping. And then if they're concerned about a bacterial infection, they may do a swab or a slide. And that is to basically rule out other causes of itching. because, and that ties into the next thing, is diagnosis of allergy is a process of exclusion of other pruritic diseases. Not every itchy horse has allergies. The majority do, but not every single one. And so, and there is no, hear me, there is no diagnostic test for allergies.
Can we say that again for the people at the back?
Say it really loud for everybody.
So, in other words, you can do a skin test or a blood test from a horse that is non-itchy or is itchy for other causes other than an allergy, and you may still get positives.
Right.
So that test, it does not discriminate or give you a diagnosis of allergy. That is a test that is done once you already know that your patient has allergy and you want to do allergen-specific immunotherapy. In other words, you want to desensitize them. But it's never good practice to just run this, quote, allergy testing on any itchy horse or dog that is out there, because you may just get results that mean nothing. Okay? So the proper course is to rule out other things, make sure that you're not missing the basic stuff, you're not missing the infection, you're not missing the mites, and you're doing due process. And then you're left with the diagnosis by exclusion, a clinical diagnosis of allergy. And based on the distribution of the lesion, you can say, okay, you're more consistent with insect allergy, or you are more consistent with pollen allergy. And then with the insects, unfortunately, we cannot desensitize you, so we need to be very aggressive with fly repellent. With the pollen, we can say, yes, I can desensitize you. So let's find out what specifically is your IgE profile so that I can select the right pollens to put in the vaccine and desensitize you. So that's basically how the process works.
So I think you answered a whole bunch of the things I was going to ask you. Is like, if I call my vet, what might they do to help my horse? But, we've talked about, like you said, you're going to start with probably saying to get some Benadryl and get that in there and see if that's going to help. And then you can do the skin scraping, moving on to allergy testing. But right in the beginning, if I call the vet, we're just starting on this. What are going to be those first steps that they're going to take?
So hopefully kind of give you some general education, right, on how to manage. I mean, the main concept of owning an allergic horse in general is to be knowledgeable about, insect control, fly control, and topical therapy. So the topical therapy, what kind of products to use, how often to use, so that basically you can kind of do some damage control, right? Because the animal cannot live in a bubble. And so there are all these things that definitely contribute to the level of discomfort. And so hopefully that will be the initial visit. So which will start by, okay, what fly spray are you using? Is it a repellent or not, for example? What is the management? Is it turned out at night, during the daytime, to kind of figure out a lifestyle change so that the animal can have fewer bites, Then assess, even just clinically, does it look like it may have a staph infection? Okay, I'll start by saying fungal infections are rare in horses. Unless you're dealing with a baby or an old Cushing horse, a ringworm is very rare. Okay, so the majority of the scabby lesions that people see that they think is fungal is actually bacterial. So we'll start by eliminating this misconcept, okay? So basically, they don't need to use an antifungal product. They need to use an antibacterial product, let's say a chlorhexidine-based product. that is already like using a correct fly spray and using an antimicrobial shampoo. That's already like, yes.
So you say correct
You know,
fly spray. I think we should expand on that because I remember you speaking about this at the KER conference. And I think people are, I mean, I know myself as a horse owner, I go stand at the shelf at the feed store and I've got like 30 different fly sprays to choose from and they all basically look like the same thing in a different colored bottle, and some say they last for 7 days and some for 14 days, and I think we all know that's not true anyway. But there are some differences when you get into that little, like on the front label there's often like, sort of like the active ingredients, like 3 things and percentages of inclusion of those, ingredients in there. Like, what is an effective, from your perspective, what should we actually be looking for in an effective fly spray?
okay. So there is a difference between an insecticide and a repellent.
Okay.
The insecticide is basically there's a fly and I spray with my product and it dies. Yay. Okay. But if I have an allergic animal, I need a repellent, which means I don't want that fly to even land on my animal
Right.
and take a bad meal. Okay. Because the allergy is to the saliva of the insect. So I want to prevent the bite. Then I need a repellent, a true repellent. And unfortunately, it seems like there is no enforcement of legislation on what people can write on these products. Okay. So, pyrethrin is not a repellent, it's an insecticide. You need permethrin.
Okay.
Permethrin is a repellent, depending on the concentration, or a synthetic, like a pyrethroid, like cypermethrin, right? So, examples. Okay, what are examples? So you either go to products like the Tritec and the Endure that have pyrethroids, or you need to have enough permethrin to be a repellent. So you need to have something, really 1%, 0.5 is pretty low, but certainly if you have a product and when you look on the label, and it says 0.1% pyrethrin, 0.1% per meter, that you literally will have to drown a fly with it to basically be successful.
It sounds like the
Right?
supplement market, where as a nutritionist, right, I look at supplement labels and it'll say, it's got 10 milligrams of copper in it. And I'm like, well, that's not going to do anything, right? That's pointless, right? So who knew that fly sprays were the same? It's all about the labeling and understanding how to read the labels.
Right. And so that's the thing. I think that's already part of the education, right? So that's why, hopefully when the vet comes and, spends time with the owner, he kind of like gets that information. How often are you using it? That's the other thing. Again, my thing is biased. I practice in Florida. Okay. So, but I can tell you every day is the answer. Twice a day is the answer. I don't, even if it says it kills and repels for, I don't know, 7 days, 14 days, it's so not the case.
No.
Certainly where I practice, and I don't know how this was documented in any study that led to the approval of these products, but I can tell you that basically the answer is frequent application in generous amounts. And I know that, sometimes people are, afraid of the use of chemicals, excessive use of chemicals, and I get that. And so that's why I then, in those cases, I propose an alternative. I say, okay, you don't like chemical, we can do botanical, right? So botanical, what are the options? So at this point, the most promising option is neem oil, okay? So neem oil, there needs to be a 1%, okay? And so the neem oil, and I don't mean the neem oil for plants, okay? Is their products, they are labeled for use of animals.
That's an important point. Because I was sitting here, both Jill and I both garden, and I'm thinking, I've put neem oil on my rose bushes before.
Yeah.
But there are products I've seen, especially like in more recent years, that do have neem oil in them. And I just hate the smell of neem oil, so I always stay away from it. But if you say it works, I'm on
Maybe
it.
the flies don't like it either.
Right.
And so the duration based on study is like you get 8 hours. So I would say you want to go on a trail ride, and you put your neem oil, if or depending on the smell that you enjoy. There's one product is Equiderma has neem
Right.
oil, and then sometimes people get the concentrated, but then you have to dilute it. So that's an option. Uh, so but that's a difference between insecticides and repellent
Hmm.
and duration of action. So, for example, citronella. Citronella by itself is not very long lasting or very strong. So, depending on the insect burn that you have and how frequently you want to reapply, then you select your product. So that's why most of the time ends up being some form of chemical,
Yeah.
some form of pyrethroid.
So I know that there's a lot of horses that actually react to fly spray.
Hmm.
So are there any chemicals in fly spray that may be an issue for these sensitive horses?
So the thing is, it's a moving target. Some horses that will not tolerate the permethrin will tolerate neem oil, and some horses will get red and flaky with neem oil, but they will be okay with the chemical. So it's kind of like really a moving target to trying to figure out something that the animal can tolerate. Sometimes it's the vehicle, and sometimes it's the ingredient itself.
Okay.
So when I have patients that are very, very sensitive, I ask the owner to just start with a small area, start with one leg, and basically see if it turns bright red and flaky. And then you decide whether it's okay to do the whole body.
Yeah, that makes sense, that's a good point. I hadn't thought about that, but of course, like you said, these active ingredients are often like 1% or of the whole thing, and so there's a bunch of other stuff in there that's actually might be what they're responding to, not the actual insecticide or repellent. So I hadn't thought about that. That's a really good point. I've been using picaridin for
Because
mosquitoes, because we have a lot of mosquitoes, and that actually seems to work. I read some really interesting research out of New Mexico on picaridin, and I have found, I think, like one equine, horse, and human product that has picaridin in it, and so I use that in mosquito season. It seems to really help.
yeah, 8 hours or last 8 hours.
Yeah, a little bit longer anyway. Like if they're out in pasture, at least they're, and then because otherwise they're under fans, but it's that time when they're not, in a fan that is really tricky. So you mentioned at the conference about being cautious of sort of long-term fly sheet and fly mask use. And, obviously as a dermatologist, you're concerned about overall skin health and not just allergies. What are your concerns about fly sheets and masks? Because I know they are obviously very popular with people, especially for people that do turn out at pasture.
Yeah, so I think, again, my comments are dictated by where I practice. So Florida is overall a very humid place. It's hot and humid. And so horses end up sweating underneath these fly sheets or fly masks. So, and then if you leave it on for extended period of time and kind of forget about it, then the skin starts macerating underneath. So I think skin likes clean and dry. So I think if people live in an area where the humidity is not very high, then maybe this is a solution for them. In a hot, tropical, humid climate, is typically not the answer.
Yeah.
They develop bacterial and yeast infections underneath, and then you end up having more problems than you had to start with.
I mean, I don't have the humidity that you do, but we get extremely hot. And I will say that in experimenting with sheets, I found one that's a little more rigid. a little bit more like almost like window screening. And so it actually stays off their back, between their withers and their rump, it kind of stays off their skin. I find those ones that are that very soft material that my horse hates them, but that drape over the skin. I can imagine that they literally become a second skin. And I can, absolutely imagine what you're saying, that it just creates this environment underneath it that if left on for long periods in humid weather would really be a problem.
Yeah, because the first one, the stiff one, is you have some ventilation under.
Yeah, it's not really sitting on them; it's sort of above them.
Yeah, that's very good observation. Yes.
What about allergies to bedding? Because I know a lot of horse owners believe that that's a pretty common cause of allergies, whether it's from touching the bedding or from inhaling, when you put fresh shavings in. Is that a big allergy contributor?
I wouldn't say big, but there are cases. One is the dust of the bedding, right? So, if the animal has some respiratory component, then I think it's always helpful to kind of wet a little bit the shaving so that they don't inhale all this dust. Sometimes they can also be contaminated with other things. It's not just that they have an allergy to the pine shavings, but they may have allergy to other chemicals that they were used in the process of them. So at times we do patch tests with the shavings. So let's say if people feel strongly that the shavings are a contributor, then we do the patch test to check for contact allergy. So that's a difference, right? So we talked about allergy testing before. So the allergy testing for pollen is a skin test. So you kind of like a prick test. You go with the syringe and you inject a little bit of different pollen. The patch test, you don't inject. You just literally have a patch and you put it directly on in contact with the skin for like a day, and then remove it. And you watch for the type of reaction that you have. And so if I am concerned about a contact allergy, we do patch test. And so at times I have done it with shavings. And to be honest, I never had a positive response.
Oh, wow.
Yeah.
Wow.
Interesting.
Okay, so we're getting super close to Jill getting to her pony, which I know she really wants to talk about. But you just opened a huge can of worms there when you mentioned about pollen testing being with a skin prick test. You didn't say blood test. You said a skin prick test. I feel like we need to talk about, I get so many results from blood testing for allergies. Could you just talk a little bit about that? Because I get so many responses of people who come to me because they've had the blood testing done and now they want this radically different diet than their horse has been fed because they've come up as positive to all of these dietary components and many other things, be it tree pollens, grasses, dust mites, insects, the whole gamut of things through blood testing. But I'll just let you talk about blood testing.
So I guess we'll start with the basics. So I think that the choice of the company is important, and I'm not going to get into the specifics, right. But what I can tell you is that we know that that is important minimally to go to a company that has good quality control. So that basically you know that if you were to submit the same sample under two different names, you will get the same result.
Right.
Okay. All right. So that's a starting point that at least you know that they're measuring something that is truly IgE, which in the past, I can speak for dogs, that was not always the case. This was years back, people that took the time and the energy to basically send samples, let's say the same sample divided into different tubes and send under different names, and you will get completely different results. So that's poor quality control, right? Means that you're just basically throwing some numbers that don't mean much of anything. But so assuming that the company is reputable, that indeed they are measuring IgE and not just throwing a number, then the question is how to interpret this
Right.
results, right? Okay. And so the presence of IgE is not necessarily an indication of being responsible for clinical signs. And this is why you can have normal individuals that have IgE on a blood test and it doesn't mean anything. They're non-symptomatic and they don't, right? So the presence of a positive response on an IgE test does not, in the absence of everything else, which is your history, it doesn't really help you. So the first place would be to correlate the clinical signs and the seasonality of the animal with the results of your blood test. Okay, because we tend to pay attention to things that make sense clinically. Are these allergens present in the environment of the individual? If the answer is no, then it's probably a cross-reactivity.
Yeah, I had that
The other thing,
recently. I have a client who sent me gosh, I wish I could remember now what it was. It was some.
It was flax.
No, it wasn't flax. No, it wasn't actually flax. I know it's always flax, but it wasn't flax. It was
Always
something
flax.
else. It was something bizarre, like olive, and but again, it takes us back to our very early part of this conversation where I said to her, it's what what are the chances, has your horse really been exposed to olive trees, based where the horse lives? The chances of it having it, there were no olive trees in its environment. It lives somewhere where olive trees don't grow. So it's just.
that's the thing. That it basically, the question is: are you a bogus company, or you're just simply measuring that cross reactivity? And that is why these results need to be interpreted. So it doesn't work that you say, okay, the highest number means it is more clinically relevant. Unfortunately, it doesn't work like this. Okay, so you need to go by correlating your positives with the seasonality and the environment. So seasonality, let's say, I'll give an example. My horse is seasonal in the spring. Okay, spring is trees. Okay, so I am going to pay particular attention to the positives that I have of trees that are also relevant for the region where the animal is. Okay, to avoid going on a tangent or something that is irrelevant.
Right.
Okay, if the animal also has positive to trees and to grasses and weeds, that may not be clinically relevant. You may still have IgE, but they may not be clinically relevant because grasses and weeds are in the summer and in the fall. Okay, so if the animal is quote asymptomatic that time of the year, means that doesn't reach a threshold of clinical relevance. So I don't need to do anything about that. I need to focus on the ones that are relevant and present at the time of the year that the animal is symptomatic. That is, in terms of pollen.
Mm-hmm.
Now, horses, it becomes the line between quote food allergy and grass allergy.
Right.
Is kind of blurred because while in a dog, meat is what you eat, you know, as opposed to everything else that you get in touch and you inhale and so on. In horses, grasses are both a pollen, environmental, pollen, but it's also food. And so, and those are the only ones that we pay attention, but we don't pay attention to allergy to carrots or apples or, whatever, all this other stuff that people tend to
Soy is the big
go
one.
overboard. Yes. And based on the current evidence, so there's actually a study that was published that it is basically did not support any clinical ability of a blood test to predict clinical signs. In other words, let's say you come positive for carrots on your blood test, but you then challenge the animal with a carrot and nothing happens. So that's your answer right there. That is not clinically relevant.
Yeah, I just did this recently with a client who was adamant that her horse, had a reaction to flax. I don't recall if she had allergy testing done or not, but she had previously fed it flax. It had some hives, and so she asked me not to put together a diet with no flax in it, which is quite difficult to do these days. And I sort of challenged her, and I said, if you're willing to try it, the horse had been off flax for several months at the point that she came to me. And I said, if you're up for the challenge, would you be willing to feed it flax again? Because then it should have the same clinical reaction. to the flax, if the flax is actually the issue. And so she did. So she's been feeding it flax now for several weeks. And she emailed me to say she made a fool of me. We've had absolutely no clinical reaction to flax at all.
Right. So then the question is, she was giving flax at the time for a reason. So maybe it was that the allergies were out of control, and she was hoping that flax would be the answer. But it wasn't the flax the trigger for the. It was just simply maybe not in a dose that it was effective. The other thing is the formulation, right? So it's like so. But I think that people need to go through this process of individual rechallenge if they're truly concerned about something. That's the ultimate way to know if that plays a role or not. And we certainly have some individuals that, I personally own one that there's one brand of treats that he cannot have, and he has hives.
Right.
So, but that was not diagnosed based on a blood test. It was basically, and the beauty of hives is that they are fairly immediate.
Right.
So it's an immediate reaction. Right? So it's like 20 minutes, 20 minutes. So that you can pretty much pinpoint this is your trigger.
Yeah.
You don't have to, wait days and days wondering.
Mm-hmm. No, definitely. I definitely have clients that are really adamant that, when they feed a certain thing, something happens, and I believe them. Like we take that thing out of the diet for whatever, if we can or what have you. But whether that's actually a true allergy or not, that's, I guess, up for debate, right?
Right. And so the question is, you decide whether it's worth going there, right?
And for many people, it's not, right? They're just happy that whatever the symptoms they were dealing with have gone, and they're not really willing to go back and revisit it. And as a horse owner, I understand that.
So on to my pony that I have. So I lived in Colorado, had a healthy pony. We were there 5 years, no issues. We packed up and moved to Iowa, and we were here for 4 years, and pretty much from day one, he started having issues. It turned into or became severe asthma. In January, we put him on the trailer, took him to Arizona, got off the trailer. Within 24 hours, he was 100% fine again. And clearly, there's something in the environment in Iowa that doesn't agree with him. Do allergies lead to asthma, or are horses that have asthma just more sensitive to common allergies?
So the asthma can be an irritant or can be allergic in nature, right? So the allergic one, you need to have a little bit of sensitization. But you can also have one that is an absolute irritant, right? So I don't know his lifestyle. I mean, is he spending now more time inside in a barn as opposed to what he was doing before, being outside, for example?
Yeah.
Yeah.
Because the main thing is he's in the desert, right? Like, so I lived at 7,000 feet in Colorado in the arid desert. Then we moved here. We're sitting in the middle of the corn and the soybean fields. And then we took him to Arizona, so he's back into the desert.
Yeah.
To me, it just says, plants, pollen, whatever the case is.
It could also be like an irritant, right? So if you say from day one, the moment that he moved, so you probably have a higher exposure also, to be honest, to chemicals, right?
Yeah.
Yeah. And that is a big component. So there is this, this is a big chapter, but, and this is true for us as well, not just our animals, that, we have increased our exposure to all kinds of chemicals. Let's say they're used, for the fields, for fertilizers and so on. And so many of them, they damage the epithelial barriers, whether it is in your lungs and in your skin. And so that is not because the individual would be otherwise allergic. It just simply is a man-made allergy, due to exposure to chemicals that are damaging. Yeah.
We could never get his immune system to calm down enough to, like, we never did any of the allergy testing, any of that type of thing, because we just knew that it was so inflamed all the time. We'd never get an actual answer to what was going on. But like I said, we tried everything to treat him. We changed his environment. I mean, the vet was here 3 days a week. We were doing everything we could. And it's just funny because as soon as he got off the trailer, literally went right back to work, went off every medication he was on, no more nebulizing. It was instant.
Right. So that's not a knowledge, right? So, yeah.
Yeah.
So he lived in Arizona now?
He's living his best life in Arizona. So I'm getting a new horse that's from Ohio, also used to living with pollen. So hopefully this one will come here and be okay. Fingers crossed.
Yeah.
All right.
So one of the things, I mean, John, I think you managed to avoid, in your allergy journey, did a pretty good job of avoiding having to give him steroids, right? But I know that sometimes for horses that do have allergies, when they sort of do get out of control, that is sort of where we end up, right? Is giving them a course of steroids. Is that correct?
Yeah, sadly.
Yeah. We don't, like to your point earlier, we don't have a lot of other options, right, for horses.
Yes, I think horses are limited. And so for some things, the antihistamine might help you, like the Hives, and we use also, I personally use a lot of pentoxifylline, like Trento. It's an anti-inflammatory, but it's not a steroid. And matter of fact, it's used sometimes as an adjunctive treatment for founder. So it not only does not cause founder, but it is a
It
treatment.
helps.
It helps. And so that is useful for allergies and whether skin or respiratory. But yes, some individuals, at least in the short term, in the acute phase, they may require some glucocorticoids, some steroids. Yes.
And I'm just going to speak to this for a second because I'm like such a huge advocate. I see all these people posting that's like, my vet came out, my horse having, he's coughing, his asthma, whatever. And so they said, to put him on a treatment of Dex. And they've got a picture of their horse up, and it's a cobby type, overweight, been staying in the field, hasn't been ridden. I'm like, you really need to talk to your vet before you start giving that Dex. Like, you have a really high chance here that it could founder. There's other options out there. They're not as easy as just giving a shot of Dex. But I can say in the 4 years that I managed it, there was only 2 times that I gave it. And one was like, he was coughing so bad. It was pretty scary at the time. And, instantaneously we got him some relief. But there are a lot of options that are out there that I know that vets, they have to know so many things. And, Dex, I think, has always kind of been the go-to. But there are certainly other things that you can try before getting to that if your horse is at risk.
Right. And that's the thing, so basically know who the patient is and what's the risk and also what is the duration of the treatment. Right. So I think a metabolic horse, it's not a good candidate. The other thing is, and I think that that's where sometimes things go wrong, is that, it's not a substitution for a workout, right? So it's basically something that needs to be used, for short amount of time, and for the acute crisis, it cannot become that this is the routine. that, every day, every other day, you end up, relying on the steroids. Sometimes, people do it because, it's quote convenient or the animal responds and so maybe they don't know enough or I don't know. But it should not be a long-term strategy. It should be a short-term strategy. That's for sure.
Yeah. So I've heard some horses being given injections for allergens that they have a sensitivity towards, like similar to people who get allergy shots. Could you explain how that works and whether they are actually effective?
Yes, like allergen-specific immunotherapy. So the answer is it works, and it works well. Particularly, horses are very good species to do allergen-specific immunotherapy because their success rate is pretty good. It works particularly for respiratory allergy, like in human medicine. Allergen-specific immunotherapy initially was used for asthma. And then in more recent years now is used also for skin issues like atopic dermatitis. But the initial application was asthma. And in horses, we use it for both skin allergy and respiratory allergy. And the way this works is you end up selecting the allergen based on your allergen skin test or blood test. And you're limited in how many allergens you can put in the vaccine, which is typically 12 to 14 allergens. And then you build up the dose. So you start with very small amount. There are typically three different vials, and you have a schedule, and owners can do the injection themselves. And the idea is to build tolerance so that you start with very little, and then you progressively every few days, increase until eventually you get to a maintenance, and then you keep that maintenance. And once the animal is on maintenance, the injection is typically every 3 weeks. And that is to shift the kind of immune response that the individual builds against the allergens. So at the very beginning, we talked about the difference between the normal and the allergic, right? The normal makes a good type of antibody like IgG, and the allergic one makes the IgE, which are counterproductive. So the idea with the allergy vaccine is to shift that kind of immune response. So then eventually they are re-educated and they produce IgG versus IgE. This process takes months, and so it's not like the quick fix. In the meantime, they may still need supportive treatments of other sort. But then eventually, there are now studies that show, after the first year, maybe, 70, 80%. And then after the second year, it could be 85%, And in a place like Florida, it basically becomes a maintenance. I've had one of my own horses eventually, after a few years, I was able to stop. But I started young. He was a COPD horse and also has skin allergies. And he was a 2-year-old. And so by the age of 5 or 6, I realized that he didn't need it anymore.
Wow.
But so there is also that window of opportunity of the immune system, right? When the immune system is less set in its way.
Yeah.
Yeah. And so that's an option.
I say that for the people that come to me who just have fairly, somewhat mild allergies. I'm a big believer in omega-3 fatty acids. And I suppose, this is a podcast mostly about equine nutrition. So here's our equine nutrition moment for this episode is the omega-3 fatty acids. But I always say to people, like in the spring, by the time your horse is having symptoms, it's like you're playing catch up at that point, right? It's like it's going to be very hard for an omega-3 fatty acid to make a really major dent in your horse's, allergic reactions. But if you can start it before they're symptomatic, it might help you. It'll potentially help you more. Do you do things with omega-3 fatty acids with these horses as well? And do you see that they help?
Yeah, so you made a very good point. So essential fatty acids um, are unlikely to be effective as monotherapy,
Right.
right? So if people rely and think that that's going to be the only thing, you are looking for mild cases, right?
Right.
But if have cases that are a little bit more severe, that is one of the things that people can do, but it's not going to be strong enough to override everything. I think essential fatty acid can be extremely helpful in many different ways. One, we have evidence in other species, not in horses, but in other species, that they improve skin barrier function.
Mm-hmm.
And so back to why some individuals absorb more pollen through their skin. Well, because their skin is not normal, right? And so essential fatty acids are beneficial for that. They're anti-inflammatory and so on. But again, it depends on the severity, right? So if the individual is extreme, then it's going to need other things besides the fatty acids.
Right.
And actually, there's a study published in Dogs that looked at the combination of pentoxifalin and essential fatty acids and found that to be very beneficial. So I think that if people can get in this mindset that yes, before the season, and then do some topical therapy, do some pentoxifalin, you make sure that you have enough omega-3 in your diet. If not, you need to supplement. There's a study that looked at topical fatty acids, and that actually had positive outcome. So the basically is a multitude of things that can be done to nurture the skin and decrease the inflammation.
Yeah, the topical thing is fascinating. I remember you mentioning that at the conference, and I sat there thinking about. I had done some work with a company that had an omega-3 oil. And they were based in Florida, and they swore that and it was an oil for oral consumption, but they found that if they put some of the oil like in a bucket of water, like they would wash the horses off, and then they would rinse them with this bucket of water that they had put a couple of ounces of oil in and just sort of mix it around, and then they just put that on as the last thing they put on the horses. The grooms of these horses were, claiming that this was really helping with that sort of Florida skin funk, right? And at the time, I was just sort of like, really? It's like, I'm sure it makes the hair shiny. I didn't really think much of it. But then when you said that at the conference, I was like, I remember these conversations with these grooms that were like putting it in the wash water at the end. And I was like, oh my gosh, it's actually a thing. It probably actually was doing something. So
it's interesting how, you have this initial observation, but then the brain kind of like, doesn't pay attention to it because we cannot explain it, right? And so this is not real, right?
And that was like 5 years ago that I was hearing this from these grooms. And then there I was 5 years later sitting in a conference, and you just said that. It was like one sentence you said, and my brain went, whoa, hang on a minute.
And you have to go back and,
exactly.
Oh, you were right.
Yeah.
Yeah.
And I do.
No, there's that.
I was going to say, I definitely, for these horses especially, I mean, I tend to lean towards doing fish oil just because it is a more potent omega-3 than flax. And a lot of the work that KER has done showing that the fish oil is a little more effective than flax, especially depending on the rest of the horse's diet. If you're feeding a lot of omega-6 oil, especially, the fish oil is likely to be a little more, easily utilized. So I do tend to do fish oil for these horses. But this has been a great conversation. I mean, we really appreciate your time. And before we go, are there any points we haven't covered, or things you think are important, or anything in particular you'd like our listeners to take away from our conversation?
So much to say.
We can always have you back.
Yeah, do you want to come back? We can do it again.
I mean, I've had so many just sort of like wow moments during our conversation. It's been great.
I would say, to maybe decrease the emphasis on this allergy testing.
Yeah.
Basically not bank everything on that. And I also know of a company that, when after they do all this test and then they provide these vaccines that have a bunch of insects in the vaccine. And even if there's evidence that this does not work, I would say if to basically be an advocate for your horse, and and if you're not sure that this is scientifically sound, to seek an alternative opinion, educate yourself. At this point in time, we we don't put insects in the vaccine. We only put pollens, and the insects. Unfortunately, at this point in time, we need to do insect repellent. Maybe one day things will be different if we have the recombinant allergens, but just crushing up, no-see-ums or deer flies or whatever is a waste of money, is a waste of precious time. That's one thing. And then the other one is not to wait too long.
Yeah.
If, let's say, if the horse lives in a certain geographical area and is there to stay, then I would say the moment that they realize that, let's say the first season, fine, but the second season is more severe, to basically seek some help so that the animal can be placed on some form of immunotherapy, since it takes time to build that response. And so that it doesn't get in this downward spiral of infections and all that, because then it is more difficult to turn them around. Plus, it's a miserable life.
Yeah.
So, at some point I was actually working with the human dermatology group here at the University of Florida. And I remember one comment, we think that itch is a nuisance, right? So it's not as bad as pain. Pain, we're all aware how devastating pain is. But listening to a dermatology patient saying, I would rather take a beating than being itchy all the time. Then that obviously the human can vocalize this, right? But animals don't. They just take it. But being, very, very itchy for extended periods of time, it's just a miserable way to be. And, and so I think that the sooner that they seek help for their animal, the better it is. That's what I hope that people can remember. Yes.
If our listeners want to follow your work, where can they find you?
At the University of Florida. I don't have my own podcast, but I am under the UF webpage. Okay. And they can also send me an email if they have any questions or concerns or anything that I can help with their own animals. Is my last name at ufl.edu.
And I'll put that in the show notes so that they can contact you if they want to, if they need to. And is there any other resources that you steer people towards that we should also put in the show notes if listeners are having issues?
Like good resources for allergies, like good information.
Yeah, so I certainly, I write lots of chapters and things like this. Depends on the knowledge, the level of understanding. There are plenty of pieces there, like in lay terms, that I have contributed in different magazines, as well as the actual book chapters. But I can send you some information of references if people want to expand on that. Yeah,
I think
if you want to send those, I'll put them in the show notes for sure.
Yeah, and I think there is, the other thing, Jill, we should put in the show notes is I believe that there is a publicly available, you can get we didn't touch on this, but there is a consensus statement.
So the chair of the international committee that did this consensus guidelines of the treatment of skin allergies in horses.
Yeah, and I think that's a very good resource for people if they're having a conversation with their vet and maybe their vet is pushing, blood testing for things that maybe is not appropriate. It's a good resource to have to be able to hand to their veterinarian, because it is written by veterinary, dermatologists, that really explains the current sort of status of our understanding that owners might find helpful to have.
Yes, that would be interesting if an owner is that to the vet. But yes, at this point in time, is the most comprehensive, review of what is the current level of knowledge and the recommendations. Yes,
Yeah.
and the fact that we have zero evidence to support blood testing for the diagnosis of food allergy in any species, in horses as well as in dogs. In dogs, it's the same. So you're not alone. So,
yeah. Well, we'll just keep getting the message out there, and I think, to your point, it is important that people understand this, because I realize, as you were saying, talking about that, it's easy to kind of hang your hat on one thing, right? And it's like you become so all involved in, this is my solution, this is my answer, when it actually isn't. And then you're not actually looking for the actual solution and the actual answer. And then the horse is the one that suffers, because, you've gone down this path and you're putting all your, you're investing 100% in this pathway that actually isn't perhaps going to give you the results that you want, versus being open to maybe some other things that might work better and help your horse more. So I think it's important. So
to be good advocates for them, right?
Exactly. Yeah, we have to be their voice. Well, thank you again for joining us. It's been a super conversation, and we'd love to have you back. I'm sure we're going to get a lot of questions from people. This will be
Very good. I hope it was helpful.
Before we end the episode, we wanted to share something exciting. You heard our guest mention Equiderma horse spray with neem oil today, and we're thrilled to share that Equiderma has given us 2 discount codes just for our listeners. Use SCOOP to get $2 off a quart, or SCALE to get $5 off a gallon. Codes expire June 30th and can't be combined with any other offers. Check them out at equiderma.com. For our listeners, if you'd like to be a part of our conversation, please send your suggestions for future topics and equine nutrition questions to info@scoopandscale.com, and is spelled out. You can also find Claire at clarityequine.com.
We know that if you're like us, you're probably listening to this while driving or doing barn chores. But when your hands are free, if you'd share it with your friends on social media, and be sure to subscribe on your favorite podcast platform, it helps other horse lovers like you to find us.
For the Scoop and Scale podcast, I'm Jill Jackson.
And I'm Dr. Claire Tunis.
Thanks for riding along with us.